Good evening, everyone, and welcome to our Health Career Symposium. My name is Walt Tobin, and I serve as the president here at OC Tech. And on behalf of the faculty and staff, I'm glad that you're able to join us this evening. When I think about careers in healthcare, I think that they are one of the most important aspects of the sustainability and survivability of a community in normal times. And in a time we're facing a pandemic, I think those folks who pursue a career in healthcare are even more important. So there's a lot of information for us to share with you all this evening. And I want to share first just a couple of slides about the college itself, and then we'll get into the presentation at hand. First, we think of ourselves as being successful. We provide a high quality academic experience for our students in a nurturing environment. And so we have a significant number of academic supports that we provide to our students, faculty advising, tutoring, and just a variety of counseling services that we are putting in place to help our students to be successful. We have a low faculty student ratio. We believe that our students need all the attention that we can give them. And so rather than put you in a class of 300 students, we're mindful of the fact that learning occurs in small groups. The job placement for our graduates is somewhere around 90%. And for in our healthcare and nursing programs, that number is 100%. And I think it's been that way as long as I've been at the college, and that's been almost 20 years. The reason you're here, we have top-rated nursing and health science programs. And so if you look at the success rate on a licensure exam for just about all of our programs in this division, that number is near perfect. And we're very proud of that. And I think that's one of the reasons that you all are here with us this evening. We are flexible. We know that students have challenges outside of and responsibilities outside of school. And so we are mindful of that in terms of the programs that we offer and the courses in which we've been able to offer those programs. We have invested heavily in our own technology. And so we're able to provide courses in a variety of formats to our students that allows them to be successful, but also allows us to meet their needs. The other thing I think is important is as far as our flexibility is concerned is we've created programs with seamless transfer to many of the four-year institutions in the state, and in particular, MUSC, and you'll hear from Dr. Geller a little later. But on the front end, we've created multiple entry points for students, and on the back end, once they graduate, there are opportunities for them to transition into the workforce, but also opportunities for them to continue their education and pursue advanced degrees if they so choose. And finally, we're affordable. And so if you look at the cost comparison between OC Tech and many four-year institutions across the state, you'll see that we provide a significant amount of cost savings to our students. Our faculty are taught by master's prepared faculty. And so not only do you get an education at an affordable cost, it is of high quality, and we save thousands of dollars for students, for those who want to pursue a baccalaureate degree. We talk about graduating with little to no debt, but in most cases, we've got several state-funded scholarship programs that allow us to provide a college education to our students almost at no cost. We say free or almost free in most cases. And it's my pleasure to introduce the panel. Our featured speakers this evening, Dr. Stephanie Gadsden-Brown, who is the Dean of Healthcare Preparation and Workforce, Candace Tooley, who is the Dean of Nursing and Health Sciences, Deborah Cooper-Davis, who is the Director of our Early College Program, and Dr. Lauren Geller from the Medical University of South Carolina, who is responsible for the Healthcare Studies Program at MUSC. So, Dr. Brown, I'll turn it over to you. Thank you all again for coming.
Thank you, Dr. Tobin. Welcome everyone to our session. We have several programs that we're going to focus on this evening, and hopefully we can get all of your questions answered about all of our programs. Now, I represent the Healthcare Preparation and Workforce Division, And we strive in this division to provide realistic options with built-in employment opportunities. We try to grow the healthcare workforce in our community and also create pathways leading to advanced degrees. Now, we actually have sort of 3 subsets in our division. Those are the certificate programs, the preparation programs, which is nursing and healthcare prep and clinical studies. And we also have some university transfer options. Now, our certificate programs, these are programs that can lead to employable skills in just 1 to 2 semesters. They mainly lead to your entry-level positions in healthcare, and we'll focus on all 4 that you see here, starting with certified nursing assistant. Now, this is 1 course. It's 1 semester in length, and in that course, we teach basic nursing skills. So it really gives students the exposure that they need, especially if they're interested in becoming an LPN, an RN, or even something as advanced as a nurse practitioner. You can start here and sort of get that exposure to the field of nursing. Phlebotomy technician, this is your blood drawing. Students learn how to blood draw through venipunctures and also capillary punctures. This course is also 1 semester in length. Electrocardiography technician, this is your basic cardiac testing. This is also 1 semester in length, and these 3 are under the umbrella of the patient care technician. So students can come into the patient care technician certificate program and get these 3 certifications individually and then work as a patient care tech. We also have the emergency medical technician program. This provides training in emergency response. This is also the first step to becoming a paramedic. We do have 1 semester and 2 semester models for EMT, and it really depends on the student's schedule as to which one fits better. So we do have some flexibility with this as well. This is Anika Gupta, excuse me. She actually came to us in our early college program. She finished there and went on to USC Honors College to study biochemistry and molecular biology. And she came back to us while she was in that program to get her certificate in EMT. And all of this was in preparation for her to go to medical school. And we'll talk about her further on in our presentation. But this is just one of the ways that you can take one of those certificate programs and really use it to meet your needs and what your goal actually is. Now, our prep programs are associate and applied science and general technology programs, and they are designed for students that might be interested in one of our competitive programs. And competitive entry simply means that there's another process for students to go through to get into the program. All of these options have built-in certifications. So the classes and the certificates that we just talked about, students also have the option to do those while they're in either the nursing track or the healthcare track. Now, your nursing preparation and clinical studies track, those are designed for students that are interested in becoming a registered nurse. That's your associate degree nursing program. Your practical nurses, that's your LPN program, and students that might already be an LPN that are coming back to get their RN. So those students can go into this nursing preparation track. The healthcare preparation track is designed more for our health science students. So your radiologic technology, physical therapist assistant, medical assisting, and those students that might not know what they want to do in healthcare. They can come into this healthcare preparation track, complete some general education classes, and also complete some certificates to sort of decide where they're best suited. And so to learn about those competitive programs, I'm going to hand it over to Candace Tooley, who is the Dean of Nursing and Health Science.
Hello, everyone. Thank you for joining us tonight so you can learn about our programs here at Orangeburg Calhoun Technical College. We are happy to have you here with us tonight. So tonight we are going to talk about each one of our nursing and health science programs, and you are going to meet the program coordinators, the deans, and those types of things. Our programs do, not the dean, I am the dean, but we're going to talk about each one of the programs, and you'll get to meet the program coordinators and those types of things. We're going to watch some videos, okay? They're not very long, they're very short. So we do support the mission of the college because we provide relevant training. We provide it in a flexible environment. And we promote self-reliance in our students. And we do our best to help grow our region and put out our students out there so they can become wonderful employers. Our programs are all accredited. All of the programs have been accredited within the last 3 years. Radiology is coming up. We have great pass rates on the licensures, up to 90 to 100%, pretty consistently. Sometimes we have a bad year, but that's okay. It happens, okay? All right, so all of our programs are competitive admissions, as Ms. Gasson said, Dr. Gasson said, and that is because of the rigor of our programs. The diploma programs are 3 semesters, and then our associate degree programs are anywhere from 3 semesters to 6 semesters, depending on which one you choose. We use clinical sites across South Carolina. Most of our clinical sites, you're scheduled to go 2 days a week. However, for physical therapy assistant, if you decide you want to apply for that program, they go for 7 weeks, and they actually work. It's like they're working there. They're there for 7 weeks for 5 days a week, working with the clinical instructor. So that one's just a little bit different. Employee and agencies, they vary. It could be hospitals, nursing homes, outpatient centers. So there's so many different opportunities for employment out there based on what your desires are. Our programs do have lifelong learning, and we support lifelong learning by our 4-year agreements, our agreements with the 4-year colleges. We want you to go on and obtain your master's and bachelor's and those types of things. This picture is a picture of a nursing and health science faculty, minus a few for various reasons. But I tell you what, this faculty is dedicated to student success. I am so proud of them. We know life happens. It happens to all of us. However, with our students, we look for resources. We find ways to keep them in the program and keep them on the track of success. And we have administration support in doing that. And so I'm really proud of what we do to foster student growth and to keep them on the correct track. Our purpose in the program is to create opportunities, not create roadblocks for our students. Okay, so for the first set of programs we're going to look at, that's nursing. And Susan Chavis is our program coordinator over our nursing programs. We have all types of different programs. We have the LPN program, the Associate Degree of Nursing program. Then we have one for LPN to ADN transition or flex options. All of our flex options are just that. They're flexible for the working adult, because we have older adults in a lot of our programs, and we know they have children and jobs and different responsibilities. So we want to make sure our programs are flexible enough to meet the needs of our community. So we're now going to look at each video for our nursing programs, our practical nursing, and our associate degree programs.
Our practical nursing program has 2 options, traditional and flex, which is for people who are already working in the healthcare field with some type of certificate. Both options are 3 semesters with on-campus lectures and activities in our skills and simulation labs, and on-site clinicals in local nursing homes and the regional medical center. Students take our Fundamentals of Nursing and Drug Calculations course, 2 med-surg courses, pharmacology, pediatric, maternal newborn, and leadership gerontology before preparing for state boards, where you obtain your license to practice as an LPN. Flex students only come to campus 2 days a week, 1 day for lecture and tests, and the other for clinicals. Licensed practical nurses can work in hospitals, long-term care facilities, home health, and doctor's offices. There are all kinds of opportunities for LPNs. And practical nursing provides a nice introduction to nursing for those who might not be sure they actually want to work as a nurse. It gives them the opportunity to come back and earn their associate degree through our flex and transition programs. It's a quick way to get a job as a nurse and then further your degree. Nurses will never collect unemployment. There will always be a job for you somewhere.
Hello, my name is Crystal Williams, and I'm a recent graduate here at OC Tech from the LPN program. I am currently attending the LPN to ADN Bridge program. Each one of my instructors have a unique style, a sense of teaching, and what they would do, they took the material and made it seem so easy, even when it was hard to grasp at times. So what I would say to anyone, if you're a visual learner, auditory learner, or hands-on, you can get this. We started out with taking tests weekly. At one point, it may have seemed overbearing. However, it was only to build my knowledge base and to tie the body systems one into the other. The ATI program that we utilized, it showed my weakness areas, which was very helpful at the time because it allowed me to focus on those areas to successfully pass my NCLEX on the first try. The hands-on skills labs that we had with the checkoffs, as well as the online virtual simulations, were perfect in setting me up for being successful in clinical. So there are a lot of tools that OC Tech has offered, but those was just some of the very few that were very helpful in my success in becoming a graduate and now currently a licensed practical nurse.
Really, the demand for any nurse is in such high demand these days. What makes a good nurse? OC Tech, I'll never forget, Miss Sandy DeWitt taught us, I think it was the first or second day of class, if you're in this for the money, you're going into the wrong field. You have to be in nursing because, number one, you love it. You want to help people who cannot help themselves. I tell my staff, I even tell the grads that come through, even the students that come through, if you're not going to come in here and take care of these patients the way that you would take care of somebody that you love, we don't want you here. We want you to, when you come through this door, no matter what you have personal going on, you have to set that to the side. We are in the business of taking care of people, and we've got these people's lives in our hands. And to me, that's what makes a good nurse.
Our associate degree nursing program leads students to a career as a registered nurse. We have 3 tracks available to students. The traditional program is 5 semesters, while our transition and flex options offer licensed practical nurses a faster track to earn their ADN. This is an intense program that requires a lot of dedicated study time. All of our ADN students participate in a variety of clinical settings, from the operating room to psychiatric rotations in our local hospitals in Orangeburg and Columbia. When they're on campus, they're practicing in our 29-bed skills lab or our 8-bed simulation lab. The state-of-the-art sim lab has a pediatric and adult mannequin where students can practice real-life scenarios. It's like you're actually in there with the patient.
Who are you?
We even have a maternal newborn simulation where students can deliver babies and do newborn assessments. This lab provides a safe environment for students to learn, ask questions, and make mistakes. What you learn on day 1, you're going to have to know until death do you part. And learning will never stop. Students apply up to 6 months before our nursing programs begin and must attend a health information session, or better known as HIP, to get the application. Graduates can work in acute care, critical care, surgery, home health, long-term care. Basically, registered nurses can work anywhere. The job opportunities are limitless, and you will always have a job.
My name is Joshua Valentine. I'm a registered nurse. I'm a traveling emergency room nurse. I go from state to state. As a traveling nurse, I get to see a lot of new places, get to meet a lot of new people, people that I would have never met if I would have stayed at one facility. It also gives the opportunity to make a lot more money, especially due to the recent spikes in COVID. As a student coming into nursing, I recommend that you get ready to study really hard and just keep striving. It's hard, but there is a light at the end of the tunnel.
The demand for nursing is tremendous. Not just South Carolina, but the entire United States has a great need. Some of the most recent studies that I saw is that nursing is now cited as the third most demand career in the United States. Having worked with the OC Tech College, we have been so impressed here with the types of graduates that they have, and even their nursing students coming over. They've been clinically trained. They've had a lot of skills lab type practice, and they come here knowing, being able to connect the theory along with the clinical hands-on application, which is huge for us. One of the things that's very interesting, especially for younger people to know, is that a nursing degree, when you get out of school, within usually the first year or so, you can easily be at a salary of anywhere from probably $55,000 to $75,000 starting off, and then within a very short period of time, depending on which career path you go up, you can easily end up at $100,000, $150,000, $200,000 salary.
Okay, now we're going to move on to our health science programs. These are our program coordinators. Radiology technology is Fran Andrews, physical therapy assistant is Lynn Fralix, and medical assisting is Chaka McGee. Anytime you have any questions, myself or my healthcare program coordinators and nursing program coordinator will be happy to answer any questions for you. So please don't hesitate to reach out. Each one of these programs are very unique, and you'll see the pictures and some of the interesting things they do, such as a physical therapy assistant. One thing about medical assisting, what we're doing right now is working with the Regional Medical Center to develop some apprenticeship for our students, and that is going to be very promising for our college and for our communities. On the conclusion of the medical assisting video, then you will be introduced to Dr. Davis, and Dr. Cooper Davis will go over early college with you.
Our 2-year competitive entry Rad Tech program is intense. Students should come in with good study and time management skills, as well as a strong background in math, biology, anatomy, computers, and medical terminology. Radiologic technologists work in a fast-paced environment with a variety of patients who have health issues and are seeking answers. Because radiology gives us the ability to see inside the body, it provides necessary information to help diagnose medical problems. Our innovative faculty empower our students for success and work to transform them into efficient healthcare workers. Our on-campus lab gives students hands-on experience with equipment that they'll actually use in the field. This gives them an edge in their clinical rotations. Courses build on each other, so what our students learn during the first semester is used through their last semester. Students rotate through clinical sites at our outpatient ambulatory centers, hospitals, and orthopedic offices in Orangeburg, Columbia, and Manning. Graduates work in hospitals and outpatient imaging centers, physicians' offices, orthopedic offices, and mobile imaging units. They can even become a traveling radiologic technologist, which is a great way to see the country. Graduates further their education with CT, MRI, radiation therapy, nuclear medicine, special procedures, or ultrasound. There are a lot of opportunities to move forward in the field, and we work with our graduates to help steer them into whatever direction they want to go. There will always be a need for radiology and radiologic technologists. You've just got to be dedicated and determined to succeed.
I got into radiology because I love taking pictures. And after my 11-year career in pharmacy, I wanted to do something different. The aspect of pharmacy where we get to help people in the patient care really got me into radiology because it married those two things together. I get to help people, and I also get to get an in-depth reason of what's going on with them and how we can help make them better. So if you find yourself really loving your anatomy and physiology classes and your sciences, you'd love radiology because it really does use those things to kind of prepare you for what you would be looking forward to in starting your career in a radiology program.
Behind me, you will see that we have the CT unit that we currently image. I am a graduate of OC Tech, and we have several OC Tech students that come through and provide their clinical education that plugs in also with their didactic education as well. And they can build upon their degree after 2 years with a certificate program in mammography, computed tomography, or MRI. We do encourage all graduates to build upon their high school degree with mathematics, science, communication building skills, critical thinking skills as well. Therefore, that will be an easier transition for them in the OC Tech program.
We prepare our students at OC Tech to be good clinicians by doing a lot of lecture, and then after lecture we immediately bring the students into a lab session where they work with their classmates. They get immediate feedback from faculty. They do a lot of hands-on experiences where they just practice clinical scenarios that they will likely see once they're ready for clinic. We have 2 7-week clinical rotations where students actually go out in the field. They may go to a hospital or a skilled nursing facility or an outpatient setting, and they get to treat real patients under the direction of a physical therapist or a physical therapist assistant. Upon graduation, students have a wonderful opportunity awaiting them in the job market. So settings include things like working in a hospital. They can work with pediatrics in a school system or even in pediatric private clinics. They can work in skilled nursing homes, inpatient rehab, outpatients. They can work in industrial settings. They can do wound care. So just such a wide variety of options upon graduation for job opportunities. The demand for physical therapist assistants right now is really, really high. There's a 29% growth opportunity expected over the next 10 years in this profession. And so students have a wonderful opportunity to graduate and immediately find a job. In fact, several of our students have been offered jobs while still on clinical rotation.
I was a gymnast for about 18 years. I had an injury. My doctor recommended physical therapy. I attended and finished my treatment sessions. From then, I was in love with the career as a whole. Physical therapy is very rewarding, just seeing the look on your patients' faces when they're able to get up and walk after they haven't been able to walk before you started treating them. OC Tech's Physical Therapist Assistant Program really prepared us for the physical therapy field. They provide real life case scenarios so you can critically think on how to work with that patient. Also, a lot of hands-on so you can practice. They definitely prepared, maybe over-prepared us for our board exam. We had a 100% pass rate.
The PT program is a 3-year program at a postgraduate college that you must have a 4-year degree, but the PTA program is a 1-year college at OC Tech. Therefore, financially, your investment as far as OC Tech and coming out making what PTAs usually start is a much better investment. The one thing I look for in my PTAs are great personalities, easy to talk to, sympathetic, and really just a passion for the care of their patients. And I have found that with each and every one of the therapists I've hired from OC Tech.
Our 1-year program teaches students how to greet patients and schedule appointments, assist in billing and coding, perform vitals, venipuncture, and capillary sticks, run blood and urine analysis, assist with medical examinations, and perform EKGs. Graduates of our program are also able to receive their phlebotomy technician certification. Each class has a lab component that gives students the hands-on experience needed to fully grasp the material. Our students also participate in off-site clinicals, offering them an opportunity to use the skills they've gained in our on-campus labs at local doctors' offices. Because their skills are so broad, there is a huge demand for medical assistants. Our graduates work in hospitals, medical offices, outpatient care centers, diagnostic laboratories, and nursing care facilities. I love being a medical assistant because I love to interact with the patients and helping them, and I like all the tools that we learn with vitals. OC Tech prepared us for clinicals in the labs as well as outside of the classroom. We did clinical sites and we were prepared for job opportunities afterwards.
We're pleased to have OC Tech graduates working here in our facility. We actually have hired several OC Tech graduates in our from their medical assistance program. Those individuals worked from the front desk to the back office, and we found the graduates to be very highly skilled, very personable, and we're really excited about the opportunity of continuing a relationship with OC Tech. The medical assistance field is a very, very valuable field and a very needed field. And trying to find more and more individuals to work in the medical career, medical assistance is a vital part of the comprehensive medical team. We are very proud to be able to work with OC Tech and their graduates to help forward healthcare here in Orangeburg County and throughout the state of South Carolina.
Okay, before we move on, I see a couple of questions in the chat. The first question, does the ADN program also have a flex option like the LPN, or is it all on campus? Dean Tula, do you want to answer that question?
Yes, we do have an ADN flex option in the program. You have to be an LPN to apply for that flex option though. So it's not just a flex option for the generic student coming in.
Okay, thank you. And do we have to take all prereqs with these programs?
No, we highly recommend you actually take the prereqs before you come into the program, because our program is so rigorous and we want to see you become successful as a nurse and physical therapist. In all of these programs, we want to see you become successful.
Great, thank you. Do you have an evening class option for ADN?
No, we do not yet.
And what are the requirements for former PN graduates that want to attend the ADN program?
You have to have your LPN license, and you have to take testing, drug calculations. You have to take a fundamentals test to be able to apply to the program. So there are a few extra requirements that you have to meet.
And I will add to that our criteria for the next application cycle. We are still finalizing that. All of that should be published sometime in November. So to answer your specific question about the TEAS test, as soon as we get that information, we will put that out for you, okay? All right, moving on. Next up, I'd like to introduce Mrs. Deborah Cooper Davis. She is the Director of Early College here at the college.
Good evening. We have provided you with so much information in regards to our program. I can't understand why you would not be running and knocking the door down, trying to get the OC Tech, not only for our traditional students, but for our high school students as well. We serve Orangeburg and Calhoun County students, as well as our private institution as well. So early college is a great opportunity, not only to earn high school credit, but also to earn college credit while you're still in high school. So we have two types of students. We have what's called our dual enrollment students. These students will take college courses that will go toward their high school credit, which is required for graduation. And then we have those students who will register for what we call our concurrent enrollment. These particular students may not want to receive dual credit, but just want to get it, enhance their college opportunities, to advance their college transcript. And so I think that is wonderful, being able to take those college courses and prepare you for that next level. Next slide, please. So we've shared with you a variety of our healthcare programs, but we not only have our healthcare, we have a variety from accounting to early childhood education, truck driving, welding. We have a total of 18 career pathways under the umbrella of our early college program. So if a student is enrolled in early college in one of these pathways and they're not ready to go to a four-year institution, we can provide everything that you would need to prepare you for that next level, not only to attend a four-year degree program, but also for the workforce. So again, run. We are registering for our spring semester. So we are wanting you to take full advantage of the opportunities that are afforded to you here in Orangeburg County and at Orangeburg County Technical College. Again, we have what's called our career pathway for health careers. We have an Associate of Arts as well as an Associate of Science under the University Transfer track, as well as our Nursing and Health Science track. And I think they've shared some wonderful information earlier. So if you're interested, and I know you are, I would encourage you, you can always visit our website, and the website is listed here on the screen for your viewing. Complete an early college application packet, have it approved by your high school counselor or principal, and submit that information to your school counselor or to OC Tech. We do accept various placement to include SAT, PSAT, ACT, and our own next generation AccuPlacer, as well as what we call now multiple measures, which is your high school transcript. So we make it very easy for you to make that decision. So we encourage you to take full advantage of what is offered here locally in your community here at Orangeburg County Technical College.
Great, thank you, Ms. Deborah Cooper Davis. If you have any questions about our early college or any of our programs that we covered so far, if you will put those in the chat, and Ms. Cooper Davis and Mrs. Tooley, if you will check those, I think we have some questions that are coming in. So the theme of our session is that we can go anywhere in healthcare through OC Tech. And when we say anywhere, that means anywhere. You could be a nurse practitioner, physician assistant, an epidemiologist, if you like data, a nutritionist, or maybe you want to become a dentist or a doctor. We can help you get there. And one of the ways that, or the most exciting way that we can get you there is through our MUSC transfer program. This curriculum is designed to transfer into the Bachelor's of Science in Healthcare Studies program at the Medical University of South Carolina in Charleston. Dr. Geller will give us more information about that program in just a bit. But basically, students would finish their Associate in Science here at OC Tech. They would finish their Bachelor's of Science at the Medical University of South Carolina. And then we could either go into employment directly from there, or we can get you into graduate school. And the opportunities are immense on that side. And I do want to highlight two of our students, actually three of our students. Anika Gupta, we talked about earlier, she came back to us to finish EMT. She is at the Medical University of South Carolina in med school this fall. We also have Taylor Smalls. Taylor came to us and finished her Associate in Science degree through that Medical University transfer program. And she went directly into MUSC's College of Pharmacy. So she is our first student to actually go from the 2-year level directly into pharmacy school. So very proud of both of those students. And we have Chris Foley, who is a graduate from our radiologic technology program, who actually went on to the Bachelor's in Healthcare Studies program at MUSC and graduated from that program. So we have tremendous opportunities to get you exactly where you want to go in healthcare. And so with that, I will hand it over to Dr. Geller from the Medical University of South Carolina. She is the Division Director and Associate Professor in the Healthcare Studies Division at MUSC and the College of Health Professions. So Dr. Geller.
Wonderful, thank you so much, Dr. Brown. If I could, am I able to share my screen? Am I already?
Yes, hang on 1 minute. Let me stop sharing and I will give you permission to share.
Okay. Thank you so much for having me this evening, and I think it's a wonderful opportunity to share with everyone what some of the opportunities that you can have for the next steps for moving on in your career in the health professions. I'm going to try and tie in some of the things that everyone has said thus far and how it relates to moving on in MUSC for a bachelor's program and then on to graduate school. So I'm going to go ahead and open up my slide here, my presentation. So as Dr. Brown had mentioned, I am the director for the undergraduate program at MUSC. The title of the program is Healthcare Studies. It is an online program. So you can get a job in Orangeburg and stay in Orangeburg and continue to take your classes and finish your bachelor's degree. We take students from the community colleges. So many of them have completed an associate's degree. So it could be an AS degree like Dr. Brown was just describing, but we also have a lot of students who have applied associate's degrees like Dr. Tooley was talking about, students who are PTAs, rad tech. So Dr. Brown mentioned Chris Foley, he was a rad tech. So there are pathways in a lot of the different programs, associate programs that Orangeburg offers. We can find a pathway to bring you on to even more education in the health professions. So you might not know what you want to do. Like maybe you think you want to be a physical therapist. You might decide to go into the PTA program and start there and get that associate's degree and get a job in PTA, and then ask what other classes that you might need to take in order to be eligible for our bachelor's program. There's only a few of them. There's a few additional general education classes. You can take them in Orangeburg and then apply to our bachelor's program, finish your bachelor's degree, and then apply to our MUSC's physical therapy doctoral program. So that's just one example. Occupational therapy, our physician assistant program. So you may think maybe you want to be an MD, you're not really sure. Physician assistant is another wonderful opportunity. And you could talk to Dr. Brown about any of these different tracks, and I'm going to show you in a minute what they are. You can talk to Dr. Brown about the different classes that you need to take and actually get set up on a path. So one really great opportunity might be, for example, getting your EMT certification and getting right into the profession of being an EMT while being on a track to go for a pre-PA or a pre-MD track, for example. So you get the EMT, you're working as an EMT in Orangeburg, you're on the track for your associate's degree that gives you everything that you need to go to medical school and be working toward what you need for our bachelor's degree at MUSC. Work online to finish your bachelor's, keep that EMT job, maybe get a job in a doctor's office, working with us at MUSC for advisement to help you sort of talk through what it is that you might need for medical school. So talking about the MCATs and how to get letters of recommendation. We work with you in the bachelor's program to help you reach that goal of moving on to some sort of graduate program. So like Dr. Brown had mentioned, there's so many different options and opportunities that you can work it out, and really asking questions of everyone at OC Tech. And then I'm available at MUSC, and then even individuals in our graduate programs at MUSC can help answer some questions and maybe give ideas of how you can actually move from where you are now to becoming a doctor or a dentist or a pharmacist. I think Dr. Gadsden's, Dr. Brown's example was really great of the student who moved on to pharmacy school. So, you know, I just mentioned all of this. This is a partnership that MUSC has with OC Tech and with Spartanburg Community College. So we are spreading out to other community colleges. So this is something we're working on in the state level. And right now, you can not just these, but you could also talk to Dr. Brown if there are other professions that you have an interest in. And we can always work together to try and figure out a way to help you sort of realize that goal. If there's a profession that you haven't heard, that we haven't said yet. So I just want to give you an idea. So again, the majority of our students in our bachelor's program come from the community colleges. This is a picture of one of our group of students. This is Chris in the middle here. And so you can see we have a nice diverse group of students. We run from some traditional students who went straight through, but we also have a lot of students who are non-traditional. So they took some time off. Maybe they became a PTA or a rad tech, and then, you know, they took some time and then they wanted to go back. So have that in your mind. Like in the future, if you don't have to go directly through. If you need a little bit of some time, you want to work and get experience, that's always good for your application. It looks good too. But just sort of have that in the back of my mind. Oh yeah, MUSC has this bachelor's program. I could finish my bachelor's degree and then maybe go on to get to graduate school. So again, we're online. So we have flexible schedules. It really enables students, the majority of our students work full time. So if you're paying for school yourself, if you want to get a lot of experience and to keep that job full time, this is a great program for you to finish your bachelor's degree. We have strong academic support. All of our students get paired with faculty to help them get through their program and to work with them on graduate aspirations, career goals. We spend a lot of time talking to our students about the different paths that they might go down. And we're very used to students not being sure. We're used to students, some being very sure and some being not sure. And the ones who are not sure, it's common, and then they'll take a class that they love, and then they want to be an epidemiologist, like Dr. Brown had mentioned, and then they take another class in policy and they want to go do policy work. And it's wonderful to watch that excitement. So if you're sort of there and you're like, I think I want to be in the health professions, but I really don't know what, you know, the more like that associates in pre-med opens up so many doors for you. Like you've taken all the prereqs for so many different graduate programs, and then you just can take classes and learn and see where your passion ignites and see what really draws you. It is MUSC. We have excellent shadowing and internship opportunities. So even though you're online, if you were to get into our bachelor's program, you are an MUSC student. And so you can come down to campus. You guys aren't that far, and you can use our resources, the library. We have a Center for Academic Excellence that provides writing support for our students. That is absolutely phenomenal. The students love that. It's a free resource. Being in our undergraduate program might open up opportunities to network with our graduate faculty. We've had students do research with both our undergrad and graduate faculty. Because the program is really built for students who are going to work full time and who need to get that extra experience while going through finishing their undergrad. So our students take about 12 to 13 credits a semester. So it's different than the 15 that you might take if you had a full course load. And that is to take into consideration that a lot of our students are shadowing or interning or working in order to get that experience, that they really need to be competitive for our graduate programs. We do have a holistic admissions process, but we have a sort of preferred minimum GPA of a 3.0. So that should be sort of the minimum that you're shooting for. But we do look at a lot of different things when we review the application. So if your GPA is a little bit lower, I would still recommend that you start the process. And we start that with a unofficial transcript review. So because we require our students to come in with a minimum of 72 credits and all their general education coursework, it can be confusing for somebody to figure out how to do that. So we do unofficial transcript reviews where you can send us your unofficial transcripts and we'll let you know if you have everything you need. And if you don't, we'll let you know what you're missing. So if you think you want to be on this track, then I suggest that you reach out to me like a year before you graduate, and we can get that process going so we can have that discussion and give you some pre-admissions advisement. You need 2 letters of recommendation, a personal statement, and a resume. So make sure you want to start to like get all that stuff, you know, in the works. So have that on your mind. We only have 1 start date in the fall. And so, you know, we will, you know, ideally start the conversation October, November. So if you were to want to start next fall, we should be having the conversation already. Reach out to me. Let's do an unofficial transcript review, and we'll start to get that process going for you. So for jobs, you don't have to go to graduate school. You can decide you just want to finish your bachelor's. So we have a handful of students who were, I have a PTA who finished their bachelor's and is now teaching at in Beaufort, the technical college in Beaufort. So whoever can, yeah, the name has slipped my mind. So she's down there teaching in the PTA program, and we'll have dental hygienists. They finish that program and they want to go back and teach. You can also become a certified health education specialist. You do have to sit for an exam for that, but that's a wonderful credential and it opens up a lot of doors if you just want to do health education. To be like a community health worker, so maybe you want to work in a nonprofit organization like a Boys and Girls Club. So I have a former student who was the director of a Boys and Girls Club. It's a wonderful job, very hard, but very rewarding. Being a health coach, working for community outreach, worksite wellness coordinators, big. Patient navigator is a great profession, especially if you started as a clinician. So if you were an ADN, LPN, if you were rad tech or PTA, and you want to be a little less clinical, your understanding of the clinical world is very, very valuable. And so you can finish your bachelor's degree and then get into patient navigation, and then you understand that process in much greater detail than someone who is never a clinician. We also have, so for the people who maybe they get into nursing, so if they go to finish their RN, an ADN, so associate's degree level, a lot of students will feel they have to get a BSN. That's a bachelor's in nursing. But some students may decide they don't want to stay clinical, so they want to keep their RN, and maybe they want to just finish their bachelor's degree and then go on and get a master's in public health. So that RN and our bachelor's degree in MPH is a really nice sort of combination, especially if a student wants to move a little bit out of that clinical space, but still work in the health professions or health education. Graduate degrees, I had listed some earlier, and we just run the gamut. Like, I am amazed at the variety of areas of interest our students coming in for the health professions. So anything you can think of within the health professions. I had a student reach out to me recently who wants to be a PA, so a physician assistant, but they are like a flight medic. They're in the military, so they want to become a PA and then do flight PA, which is like, I don't know that that's a profession. He was sharing this with me. I was like, oh, wow, that's really fascinating. He actually wants to be the person who, like, if they're in the Super Bowl and somebody gets hurt and they have to fly them to like the Mayo Clinic for some emergency surgery, he wants to be on the plane, like manning the plane. So there's just a lot of wonderful professions that you might be interested in. I just wanted to give you show you a few things. So you don't have to go to MUSC graduate school. It's just an option. And even if you go through the tracks with Dr. Brown that are set up to help you get into MUSC undergraduate, you don't have to go to just us. You can go to Clemson, you can go to USC, you can take those credits with you, but we'd love for you to join us. And obviously it is MUSC, but I just wanted you to see how we are taking students from the community colleges who are finishing their bachelor's degree and then are going on to really amazing graduate school. So none of these students are like straight 4.0s. when they came in from the community colleges. So they were really sort of typical students, just like you guys, just or like you will be if you're in high school now. And they are getting into Ivy League schools. Johns Hopkins School of Public Health is the #1 school of public health in the country. They're really in these really interesting professions. So we have a student who's getting a master's in biomedical ethics. And so I think we just have a wonderful culture of that lifelong learning that was mentioned earlier, and helping students reach their goal, whatever that may be. Like, it's really up to the student where they want to go. So it's not like you have to go to MUSC undergrad. It's not like you have to go to MUSC graduate school. We talk about all different options. We want what's best for you guys, the student. One other thing I wanted to mention, so we have this mentorship program. We just had a cycle just start up this month in October. We're going to do it again in the spring. So just have an eye out. I send Dr. Brown materials to sort of go out to the OC Tech community. And this is for students who are either incoming or current or previous community college students who are interested in being mentored by MUSC faculty. The student has to be interested in finishing their bachelor's degree or getting or going to graduate school, and are looking for some sort of mentorship. It's online, one-on-one mentorship over like 5 or 6 months. So this is a really great opportunity to really sit down with a faculty member and to get that sort of ongoing goal-oriented mentorship opportunity. And again, you don't have to only be wanting to go to MUSC. We do take students from the community colleges who are just interested in health professions, who may not end up at MUSC. That's not why we do it. So, and that is all I have for tonight. But I am going to open up to any questions, discussions. I don't know, in the chat, there's like.
We do have a
There's
question.
one question. Oh, sorry. Go ahead,
Ms. Blanchard. Go ahead.
There's one question that came through for you, Dr. Geller, on the Q&A page. Does MUSC have a day where we can come and look and learn about the programs at the university?
Sure. So for graduate programs, so we absolutely have on-campus days. So you can go onto MUSC's website and look for our student services page. Cami Myers, MEYERS. You can email her and ask for what those days are directly, so you don't have to like try and like go through. There we go. All right. And then we have you can sign up and come down to MUSC, and so in the College of Health Professions. Yeah, there we go. So Dr. Brown is pulling up. Yeah, it wouldn't be on our page. Prospective students, one over. Yeah. Maybe plan a visit, one over. That right there. Info sessions right there. So that information right there that's pulled up on the screen, you can get so there you go, November 12th. So they have it different, depends on the program that you're interested in. But it looks like November 12th might be.
Yeah, I think that's cardiovascular perfusion.
Yeah. But
it
it's
looks
just
like, yeah.
Multi-program PA. Yeah, so they used to do it all at one, but it probably because of COVID.
Here we go.
Yeah, they're separating out.
So these are your sessions here.
Yeah, but those are online. Yeah, those are virtual.
Yeah.
We don't have because we're online, so we don't have yeah, so but this is the page, this is where you would go to find the dates. For the graduate programs, I know we have a evening, I believe, on-campus event And this would be where you would find that information.
Yep. And all I did was I went to MUSC's website, and then I clicked on education at MUSC, and then so you come here, education at MUSC, and then we are in the College of Health Professions, and then prospective students, and then plan a visit is where you would find that information. But I can, for OC Tech students, I can post that for you as well. And I can also include this in the link for the follow-up to our session tonight. So you'll have that information. Any other questions for Dr. Geller? Well, thank you so much, Dr. Geller, for joining us. I will turn this over for questions. Anyone has any questions, you can place those in the chat. You can also email the Healthcare Preparation and Workforce Division at OC Tech at healthcare@octech.edu. If you have any admissions related questions, you can email admissions@octech.edu. And if there's anything that we can't answer, we will find an answer for you. So we do appreciate your time this evening. I will do one more check in the chat to see what we have.
We have one in the Q&A. We actually have two, and one might be best answered with Dr. Tooley or Dean Tooley. What are the days for the Flex LPN programs, and what would a clinical hours and a lecture day breakup be?
In the LPN Flex program, you typically have classes on Tuesday. They are long days, usually start about 8:30 in the morning, and they run until 3, 4, sometimes 5 o'clock in the afternoon. The labs are on Wednesdays, and those are long days as well. Once you finish with the lab portion, your clinicals will be on Tuesdays or Wednesdays as well.
And it looks like we have a few application questions. I would suggest applying online at octech.edu/admissions. And if you're interested in nursing, you can apply for the Nursing Preparation and Clinical Studies program. That's an associate in applied science program. All of your prereqs are in that program. So that's the one that I would recommend. If you're interested in radiologic technology, PTA, or medical assisting, or if you're undecided, you can choose the Healthcare Preparation and Workforce Clinical Studies program. So all of your prereqs are built into that program. We
I'll
actually
share in the
don't
chat box
have,
too. Sorry, I'm seeing some questions about scores, what might be able to be used, credits you already have. So I'll include, Dean Tooley has shared our information. Also, I'll share Michelle Flattery's information. She is our admissions coordinator for our nursing programs, and she's a great source of information for your specific transcript and what you might have that would already.
And just to repeat what we said earlier, we're currently waiting on the new admission criteria for the upcoming application cycle. In that, we will have your GPA that is going to be needed, any tests that are going to be required, and what tests will be accepted. We'll also have the application deadlines for all programs. And see if there's anything I'm missing, anything that relates to how the points are added up and calculated. All of that information, we should expect that in November. And if you'll go to our website, octech.edu, click on academics and then nursing and health science, find your program of study that you're interested in. There should be a link on that page so you can add yourself to a contact list. And as soon as we get that information published, you'll get an alert about that, as well as the HIP session schedule. The HIP sessions, you'll need to do those in order to get your application. But again, we're waiting on all the new criteria to come out, and then we'll have HIP sessions that'll get scheduled with those. So again, thank y'all so much for joining us this evening. We will go ahead and close out the session. If you have any questions, healthcare@octech.edu or admissions@octech.edu. And we appreciate your time.
Thank you. Have a good night.